everybody, my name is Sheila Ramjug and I am part of the ERS Monograph Editorial Board as their early career member representative. I'm currently a pulmonologist working in the Manchester region in the UK. Following the success of the Plural Monograph podcast, we're recording a third relating to the upcoming ERS Monograph entitled Cardiovascular Complications of Respiratory Disorders. We are very privileged to be joined by one of the guest editors, Professor Miguel Martínez-García, who is the clinical lead of the Sleep Disorders Breathing Unit at the University Hospital La Fe in Valencia, Spain, and chair of the National Spanish Registry in Bronchiectasis. So welcome, Miguel.
Thank you very much for inviting me to this podcast about our monograph. A great pleasure for me to be here with you and all the audience.
Before we get to the rationale behind the ERS monograph, tell us a little bit about your career path.
Well, I decided to be a pneumologist because it's a medical specialty that covers almost all the most prevalent diseases in the population, and also because almost all the disorders could have a pulmonary expression. I became a pulmonologist in the University and Polytechnic La Fe Hospital in Valencia. Today is one of the largest hospitals in Europe. And from a very young age, when I was resident in the hospital with 25 or 26 years old, I began to have a great interest in research in the field of pneumology, and more specifically in airway diseases, including sleep apnea, COPD, and bronchiectasis. In fact, my first publication was in 1996, and now I have more than 200 papers published. And more specifically, I am very interested in the relationship between cardiovascular and respiratory diseases, especially airway diseases.
I think that's really interesting to hear, Miguel, and I think it's obvious that you have a wealth of knowledge behind you. So could you please tell us the rationale behind this edition of the monograph and what actually spurred your interest in cardiovascular complications?
Well, when I had to choose my medical specialty, I had two options, cardiology or pneumology. And finally, I decided to be a pneumologist, but I like very much cardiovascular diseases. First, because under an epidemiological point of view, these are the most prevalent diseases in the world. Second, because most of them are closely related to respiratory diseases. In fact, there are some borderline diseases between pulmonology and cardiology, as those relate to the right heart. So many years ago, I began to research with the Spanish Sleep Network here in Spain and with the sleep group of the European Respiratory Society about this relationship, more specifically about the relationship between cardiovascular diseases, including cardiovascular events and hypertension, and sleep apnea. In fact, I'm very honored to say that the Spanish Sleep Network have made or collaborate in the majority of the largest observational and randomized clinical trial made on the relationship between cardiovascular disease and obstructive sleep apnea, and I had the privilege of participating or leading some of these projects. Moreover, I am very interested in respiratory infections, specifically bronchiectasis and chronic bronchial infection, and we are now working with my research group in the influence of these infections and cardiovascular diseases in bronchiectasis and COPD.
I'd love to be part of that research group. So I'm going to focus a bit on the actual monograph itself. So a slightly controversial question, especially if you'd like to remain on good terms with your chapter authors. But if you had only an hour to spare, which chapter would you concentrate on and why?
Well, this is a very difficult question because each chapter has been dedicated to the relationship between one specific disorder or group of respiratory disorders and their cardiovascular implications or complications, including the cardiovascular implications of those drugs used in respiratory disorders. It is true that there are some general chapters in the monograph, for example, about epidemiology, pathophysiology, or basic science or Murine model. So it is really very difficult to me to choose one chapter. However, I have to say that there is a chapter with a special condition for me. This is the chapter dedicated to future challenge on the relationship between cardiovascular and respiratory disorders, written by my colleague, Professor Don Sim from Vancouver. This is an important chapter, not only because Don Sim is a marvelous writer and researcher, but also because the topic is very interesting. Probably in the next future, we will know much better the relationship between cardiovascular diseases and respiratory diseases, thanks to the use of big data or learning machine or wearables of social network or Internet of Things and so on. We have now the computational power to analyze this very big quantity of data and extract good conclusions to personalize the treatment of those patients with both cardiovascular and respiratory diseases, and to better understand the complicated relationship between biomarkers, pathophysiology pathways concerning both diseases. These kind of patients, as the chapter dedicated to epidemiology situation says, are very frequent, not only because both diseases are very prevalent, but also because they are clearly associated, sharing some pathophysiological pathways. So, for sure, all this new technology will help us to better understanding this complicated relationship. And of course, I encourage the audience to read this exciting chapter.
In your opinion, should cardiology and respiratory work more closely together? What is your experience of joint working, and do you feel it's to the patient's benefit?
Of course, yes. Almost all the respiratory disorders could have a cardiovascular consequence. And also, almost all cardiovascular disorders could have respiratory consequence. In fact, sometimes you see patients in the emergency room, and it's very difficult to decide if these patients should be admitted into the hospital in the cardiology or in the respiratory department. So it is very important that both specialists work together, not only attending patients, but also under a research point of view. And of course, this is one of the objectives of this monograph. I think that our monograph was not only written to be read by pneumologists, but also by general practitioners, cardiologists, internal medicine, epidemiologists, basic researchers, and I sincerely think that this is one of the strengths of this monograph. And related to my experience with cardiologists, well, I think that all depends on the center you work. For example, I worked more than 10 years ago in a small hospital, and cardiologists were very close to me, so the communication with them was very easy. However, now I work in a very big hospital, and cardiologists are far away from me. So, although the personal relationship with them is very good, it is more difficult to work together because each one working to their own department. So, the short answer to your question is, of course, yes. The cardiologists and pneumologists must work together.
I think it's really interesting when I was looking at some of the questions that we're going to put into this edition of the monograph, because there were certain drugs which I totally overlooked in terms of respiratory issues it could potentially cause. So I'm not going to give the drug away, but which cardiovascular medications do pulmonologists commonly overlook? Or is there a medication which causes respiratory compromise or issues that you think we don't really take into account or don't consider closely enough?
Well, I think that here there are two parts. The first part is those treatments for respiratory disorders with cardiovascular implications. Almost all the respiratory treatments would have cardiovascular implications. For example, some antibiotics. For example, the relationship between some antibiotics such as macrolides or quinolones and electrocardiogram alterations, or adrenergic bronchodilators, some of them with interaction with heart rate. However, other cardiovascular implications are unknown. For example, the cardiovascular implication of inhaled corticosteroids. And finally, other treatments seem very safe, such as the muscarinic receptor antagonist. And the second part is these commonly used cardiovascular treatment, which could have pulmonary implications. And there are a lot of them. Some of them could provoke pulmonary inflammation, for example, amiodarone, very frequently used to treat arrhythmias. Some antihypertensive drugs, vasodilators, which could impact in the pulmonary vessels pressure. Anyway, I think that there are some very interesting chapters in the monograph on the cardiovascular effect of respiratory treatments or drugs and vice versa. And I encourage the audience to read these chapters.
Thank you. You have given us much to consider, and I cannot stress enough to the listeners again how much I've enjoyed and taken away from reading the monograph that your team have prepared, particularly as always given its relevance to our daily clinical practice of seeing people with respiratory disorders who can be quite comorbid. I'm afraid this brings us to the end of the podcast, and I'm so grateful to you for your time, and I hope the listeners enjoy this as much as I have.
Well, thank you very much again for your invitation. I would like to thank Professor John Hurst and his team from the European Respiratory Monograph for giving me the opportunity to be one of the editors of this monograph. And of course, to my colleagues and friends, Professor Mario Cazzola and Luis Pepin, the other editors of the monograph, to help me a lot in this exciting project. and of course, all the authors of the different chapters of the monograph. I hope that the audience enjoy reading the monograph because at the end of the day, this was our final objective. Thank you very much.
Oh, that's a lovely way to end this podcast. This was Sheila Ramjug interviewing Miguel Martínez-García about the upcoming ERS monograph on cardiovascular complications of respiratory disorders. Thank you all for listening.